Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I understand you've been brought here because you fainted at work.
That's right.
Can you tell me a bit about it?
I can't really remember much. I was sitting at my desk and I suddenly got this really awful headache. My head felt like someone had fired a bullet into it. I've never had anything like it. I mean, I've had headaches before, but nothing serious. And this one was different because it was just in one place, on my forehead here. I can't remember what happened then, but my colleague sitting at the next desk, she saw me and she says I collapsed onto my desk. So she came over to help, but she said she couldn't wake me up and I was out for quite a few minutes. I wasn't still. She says I was jerking, but I can't remember any of it. Apparently they called an ambulance and I do remember the paramedics arriving. And I was able to answer some of their questions, even though I was still feeling a bit groggy. They asked me if I had had any sort of trauma before I fainted, but I hadn't. I'd woken up as normal and cycled into work. Nothing unusual. Oh, and they also wanted to know if I'd taken any recreational drugs, but I wouldn't ever touch anything like that. I don't even drink. But they did ask me if I'd had any incontinence when I was unconscious. And I found that I had leaked a bit of urine. I was ever so embarrassed, but they were quite okay about it. I suppose they are used to it, and once they got me into the ambulance, I felt really awful. I had this nausea, but they gave me something for it. It's not so bad now.
That's good. So how's your health been generally in the past? Have you ever had anything like this before?
No, not really. I did go to the doctor a few years ago when I had some stomach pains. They did an endoscopy, but everything was normal and I've been fine since then. I'm usually quite healthy. All my family are. I've only ever had one operation and that was a few years back. In 2014, it was just after I'd had my 3rd child. I had to have a hysterectomy, but I've been fine since then. Oh, there was something about a year later. It must have been 2015. I've been putting on a bit of weight, and I thought it was because of the operation. But I've been feeling a bit tired as well and getting these cramps at night. The doctors did some tests because they thought I might have an underactive thyroid, but it was okay. I think maybe I'd just been overdoing it a bit.
That's excellent. Well, how do you feel now? It looks as if you've got a bit of bruising there on your face.
I think I've got a cut there, too. A little one under my eye. That must be where I fell. I've still got a bit of a headache, but nothing like as bad as it was. I do feel as if my neck's a little stiff, but that might be because I've been lying down. The paramedics asked me lots of questions to see if I had anything funny with my vision, but that's all okay.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Now, looking at your notes, I see you've been having a few problems recently. Could you tell me a little about what's been happening in your own words?
Well, yeah, it's a combination of things really. To kick off, I feel pretty tired most of the time, just haven't got the energy I used to have, and I've got this cough. It's there all the time and it feels dry.
Right?
I mean, I'm not coughing up phlegm or blood or anything like that. But the worst thing which really bothers me is that I'm so short of breath. Even if I'm just getting dressed in the morning or going up a few steps, I have to stop because I get breathless so quickly, and I've lost quite a bit of weight too. I mean, I didn't notice at first because it was very gradual. But all in all, I'm about 10 kilos, lighter than I was 6 months ago. I've not been dieting. I love my food.
Okay. And well, have you noticed anything else?
Just take a look at my fingers. The tips look swollen, don't they? And it's the same with my toes, which are bulging out at the end too. It's weird, and my nails, I don't understand it. They've become soft. They're not hard like they used to be.
Okay, I see what you mean. And tell me a little about yourself, what you do for a living.
Well, till recently, I worked as a farm laborer, did it for about 20 years. In total, it was hard physical graft, and it finally got to the stage where I just couldn't cope with it anymore. It really took it out of me. So this last couple of years, I've been a security guard, working nights at a local DIY warehouse. It's a bit boring, and the late shifts took a bit of getting used to, but it's okay.
And are you finding it less physically demanding?
That's right. I just haven't got the stamina now for anything else. In fact, I've even had to give up my golf. Can't manage it anymore. Any spare time now goes on looking after my pigeons. I've done that since I was a teenager.
Very nice. And what about your medical history? Now I see you were diagnosed with hypertension last year, and you're taking beta blockers at the moment for that.
That's right. My GP said it did help. Something the GP also said when I saw him about my breathing problems was that he heard what he called crackling noises in my chest. I can't hear them, but he could through the stethoscope.
Okay. And is there any family history of breathing or lung problems or any serious illnesses that you know of?
I don't think so. My mother was always healthy, but my dad developed bad eczema. As an adult, I remember the red patches on his hands and face, but he didn't have any lung problems as far as I know.
And while looking at your previous tests, you were diagnosed with hypertension, and about 6 months ago you had.
Yeah, an echocardiogram, to check my heart, and to chest x-ray about 4 weeks ago after I saw my GP that came back okay. As far as I know, I'm not keen on hospitals, to be honest.
I see.
Am I going to need to have lots?
Well, I'm going to suggest you have what's called an arterial blood gas test. This will let us check how well your lungs are working, how they move oxygen into your blood, and remove carbon dioxide from it.
Okay.
And I'm also going to order a CT scan now. This will be more revealing than the chest x-ray you had, and I may then prescribe a course of corticosteroids. This will depend on what the tests show up. I'd start you on a relatively low dose, and then
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
So have you had a mammogram before?
No, I haven't. And I do have a few questions, actually, like, what about the radiation? Do I need to worry about the dose? Is it likely to be harmful in any way?
No, it's very low. In fact, it's similar to the amount you'd receive if you took a long-haul flight.
Oh, yes, that reminds me. When will I hear? Because I'm away in New Zealand for a month from next Wednesday, and I'd like to know as soon as possible.
It will take about 2 weeks, but if you're concerned, we can give you a number to call.
Oh, thanks. That'll be a real help. Actually, then, for me, the big question is it going to hurt? I've been hearing gruesome stories from friends, and my anxiety levels are growing through the roof.
Okay, I understand. Perhaps you could tell me exactly what you've heard.
Now look at question 26.
It's like a normal blood pressure monitor, but it's mobile. You wear it on a belt around your waist, and it's attached to a cuff on your arm. Then you just go about your usual day-to-day activities, and it takes your blood pressure at regular intervals. It's more accurate because we can avoid what's called a white coat. The beeps first, usually every 30 minutes or so. When that happens, you should sit down. If you can, hold your arms still and keep the cuff level with your heart.
Do I have to wear it at night?
Yes, you do. You could put it under your pillow. It needs to stay on for 24 hours, though. You don't have to wear the belt. What about showering and stuff?
Well, I was about to say you should avoid that, I'm afraid.
I see.
Now look at question 27.
It looks like the autoclave is playing up again. The temperature is only 117. That's 4 degrees lower than I set it for.
Yeah. I noticed that yesterday it was at 119 and I just couldn't get it to go any higher. Shall I have a look in the instruction manual and see if I can sort it out?
Well, that might invalidate the warranty. Could you find out whether the one next door is working properly? I expect it's because the hard water around here has caused a buildup of scale, and that's affected its efficiency. Perhaps you could ask reception to get the company to come out as soon as possible. If they can't come tomorrow, we'll have to wait until Wednesday and make sure everyone knows it's out of order. If you could send a quick group email, that'd be great. That's the second time this has happened, and it's still under guarantee.
Now look at question 28.
How can I help you today?
I need something to help me manage my hay fever this summer. It's already become unbearable. I don't want to have to stay indoors when all my mates are out enjoying the good weather. We're all off camping next weekend, and I'd hate to miss out on that.
What's bothering you in particular? Perhaps I can give you something to make you more comfortable.
Well, I keep getting this horrible headache thing. It's like at the top of my nose, and it's really getting me down, to be honest. Then there are the watery eyes. I can feel them puffing up as soon as I leave the house. They're so itchy, red, and painful, and look awful. I've got a summer job working at music festivals, so there's no escaping. I'm literally in fields all day, every day. Is there something you can give me?
Now look at question 29.
So in bed 6, we have 83-year-old Mr. Beard. He was admitted this morning and he's been diagnosed with bacterial pneumonia of the right lung.
Okay.
He's quite poorly at the moment, but stable. He's lactose intolerant, so can you talk to the kitchen and organize something suitable for him otherwise?
Okay.
He has no known allergies. He's been for a chest x-ray, but we're still waiting for the results to come through. We may need to do a CT scan too, but we'll have to wait to see what the x-ray results reveal before we can arrange that.
Right?
His SATs were at 57, so he's on 2 liters via nasal cannula, and that's to be reviewed after 2 days, so not until tomorrow morning. Oh, and I forgot to mention he had a fever of 39.4, so he's also on antibiotics via IV, which he's not very happy about.
Now look at question 30.
Within the information team, we provide a set of standard and custom-made reports to suit the needs of staff and patients. Our aim is to provide information into the patient's journey from their arrival in the emergency department to their discharge from outpatients. One of my responsibilities is to ensure that the information we provide is clear, easy to understand, and straightforward to use, so that we can look at areas of concern, things that are common across departments, and reassure ourselves that we are delivering quality care. When things go wrong, we're able to provide information from the system to enable the staff responsible to review the situation, understand, and learn what needs to be changed to avoid future events.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello, doctor. What is the differential blood test?
Well, a differential blood test enables the physician to determine how many white blood cells are in the body. There are 5 types of white blood cells, and the test also shows how many of each type of white blood cells are present. The results provide details about the condition of a patient's immune system and its response to diseases.
Who requires a differential blood test, doctor?
A differential blood test helps diagnose a range of acute or chronic conditions. Often this is ordered when trying to confirm a diagnosis, such as for any signs of acute illness like the flu or a urinary tract infection. They may be looking for a chronic condition such as an autoimmune disorder or one that affects the bone marrow. The bone marrow is responsible for producing white blood cells, so changes in white blood cell counts can indicate the functioning of the bone marrow. A differential blood test may be ordered if a patient has symptoms such as body aches, chills, fever, a headache, or particularly pain in the bone. Although a differential blood test can indicate problems with the white blood cells, it will not be the only test that is used to make a complete diagnosis. The 5 types of white blood cells are neutrophils, monocytes, eosinophils, basophils, and lymphocytes. Neutrophils are the most common type of white blood cells, which are responsible for destroying bacteria in injured or infected tissue. Monocytes also destroy bacteria, playing a role in causing chronic infections and repairing damaged tissue. Eosinophils are responsible for treating infections caused by parasites, and they also control the immune system response to allergic reactions. Basophils are the least common type of white blood cell, and their function is yet to be defined. However, they may play a role in allergic reactions. There are 3 types of lymphocytes. B lymphocytes generate antibodies to attack specific viruses, bacteria, and other foreign invaders. T lymphocytes help to identify cells that require an immune response. The 3rd type, called natural killer cells, destroy cancer cells and viruses. Therefore, each type of white blood cell plays an essential role in the immune system.
Oh, I see.
When a differential blood test result is received, it should also contain a reference range of normal values from the laboratory to evaluate if the white blood cell levels are low, normal, or high. Overall, an increased level of white blood cell count above the normal level may indicate the presence of an infection. Typically, normal values for neutrophils are between 2,500 and 6,000 cells. A person with a very low neutrophil count will have fewer than 1,000 cells, a condition called neutropenia. While the results of a differential blood test will give details about all 5 types of white blood cells, the doctor will usually focus on just 1 or 2 types, depending on the patient's symptoms. For example, a high level of basophil count can indicate certain types of leukemia, including chronic myeloid leukemia. It could also be an indication of severe allergic reactions. Patients with inflammatory disorders, such as rheumatoid arthritis or ulcerative colitis, may also have high basophil counts. Typically, a low basophil count does not indicate a medical condition. However, allergic reactions, stress, steroid use, and hyperthyroidism can result in a low basophil count. A high eosinophil count can be due to an allergic reaction such as asthma, eczema, or a reaction to a medication. Inflammatory disorders such as celiac disease or inflammatory bowel disease can also cause high eosinophil counts. Usually, eosinophils are present in such a low quantity that low readings do not tend to indicate any health condition. However, stress or steroid abuse can also cause a low eosinophil count. A high lymphocyte count can indicate an acute viral infection, such as chickenpox, herpes, or hepatitis. A high lymphocyte count may also be due to a bacterial infection such as tuberculosis or pertussis, or conditions such as lymphocytic leukemia or lymphoma. A low lymphocyte level can indicate an autoimmune disorder such as lupus or rheumatoid arthritis. The presence of tuberculosis, HIV, hepatitis, or the flu can also cause a lymphocyte count to be low. A high monocyte count can be caused due to chronic infections such as tuberculosis or a fungal infection. The presence of a condition such as endocarditis, inflammatory bowel disease, monocytic leukemia, juvenile myelomonocytic leukemia, scleroderma, or rheumatoid arthritis can also cause the count to be high. Most physicians do not consider a single low monocyte count as significant. However, low monocyte results on several tests can indicate hairy cell leukemia or issues with the bone marrow. A high level of neutrophil count can be an indication of an acute bacterial infection, inflammation, tissue death, stress on the body, or chronic leukemia. The neutrophil count may also become high when the person is in the last trimester of pregnancy. The neutrophil count may be low after an adverse drug reaction or chemotherapy treatments. Illnesses such as myelodysplastic syndrome, autoimmune disorders, bone marrow cancers, and aplastic anemia can also cause low neutrophil counts. The differential blood test is one of the different lab tests that is used to confirm the diagnosis of an infection or illness.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
People with avoidant personality disorder, or APD, have a lifelong pattern of extreme shyness. They feel inadequate and are hypersensitive to rejection. APD can cause psychiatric symptoms that create serious problems with relationships and work. If you have APD, you might have difficulty interacting in social and work settings because you may fear rejection, disapproval, embarrassment, criticism, getting to know new people, intimate relationships, and ridicule. You may also have trouble believing that people like you. When you're sensitive to rejection and criticism, you may misinterpret neutral comments or actions as negative ones. We don't know what causes avoidant personality disorder, though there are many theories about possible causes. Most professionals subscribe to a biopsychosocial model of causation. That is, the causes are likely due to biological and genetic factors, social factors, such as how a person interacts in their early development with their family and friends, and other children, and psychological factors. The individual's personality and temperament, shaped by their environment and learned coping skills to deal with stress. This suggests that no single factor is responsible. Rather, it is the complex and likely intertwined nature of all three factors that are important. If a person has this personality disorder, research suggests that there is a slightly increased risk for this disorder to be passed down to their children. There is no way to know who will develop APD. People who have the disorder are typically very shy as children. However, not every child who is shy goes on to develop APD. Likewise, not every adult who is shy has the disorder. If you have APD, your shyness most likely grew as you got older and may have gotten to the point that you began avoiding other people and certain situations. Your doctor may refer you to a mental health professional who will ask you questions to determine if you have APD. To be diagnosed with APD, your symptoms must begin no later than early adulthood. You must also show at least 4 of the following characteristics. You avoid work activities that involve contact with others due to fear of criticism, disapproval, or rejection. You're unwilling to get involved with other people unless you're sure they will like you. You hold back in relationships because you're afraid you'll be ridiculed or humiliated. The fear of being criticized or rejected in social situations dominates your thoughts. You hold back or completely avoid social situations because you feel inadequate. You think you're inferior to others, unappealing. You're unlikely to take part in new activities or to take personal risks because you're afraid of embarrassment.
That's interesting.
Psychotherapy is the most effective treatment for APD. Your therapist may use psychodynamic psychotherapy or cognitive behavioral therapy. The goal of therapy is to help you identify your unconscious beliefs about yourself and how others see you. It also aims to help you function better socially and at work. Psychodynamic therapy is a form of talk therapy. It helps you become aware of your unconscious thoughts. It can help you understand how past experiences influence your current behavior. This allows you to examine and resolve past emotional pains and conflicts. Then you can move forward with a healthier outlook about yourself and how others perceive you. Cognitive behavioral therapy, or CBT, is another form of talk therapy. In CBT, a therapist helps you recognize and replace unhealthy beliefs and thought processes. Your therapist will encourage you to examine and test your thoughts and beliefs to see if they have a factual basis. They'll also help you develop alternative, healthier thoughts. The FDA hasn't approved any medications to treat personality disorders. However, your doctor may prescribe antidepressant medications if you have co-occurring depression or anxiety. People who don't receive treatment for APD may isolate themselves. As a result, they may develop an additional psychiatric disorder, such as depression, agoraphobia, or substance abuse problems. Treatment doesn't change your personality. You'll most likely always be shy and have some difficulty with social and work interactions. But treatment can improve your symptoms and help you develop the ability to relate to others.